As we mentioned, over 97,000 children were confirmed positive for coronavirus in just the last 2 weeks of the month of July. And despite the president insisting children are, quote, almost immune from the virus, and that there's just a tiny fraction of death, as he warmly put it today, he even assured the American people today that children, quote, get better very quickly. The problem is, a new CDC report warning children are at risk for severe COVID-19. While the hospitalization rate for kids is much lower than adults, the CDC reports it this way, quote, 1 in 3 hospitalized children was admitted to an intensive care unit. There's also new reporting on neurological symptoms that some infected children are experiencing. NBC News correspondent Willem Marx has our report from London tonight.
15-year-old Nia Horton is a typical teenager, but doctors say her fight against COVID-19 has been anything but ordinary.
It was really scary. I could hear voices and stuff. It's very traumatic.
The virus seemed to attack her lungs in early April, and she spent 2 weeks sedated on a ventilator. She recovered, but then her brain became inflamed, a condition called encephalitis that's visible in these lighter areas of her MRI scan.
The encephalitis, for me, in my opinion, it was worse because it was giving me hallucinations and it was just a bit crazy.
Nia's mother, Justina, says parents should know that COVID-19 can ravage not only their children's bodies, but also their minds.
I don't know which was scarier, her being on the ventilator, not being able to breathe, or the fact that she came out of it with a completely different personality.
At London's Evelina Hospital, the doctor treating Nia was paediatric neurologist Ming Lim.
Imagine not having, the ability or starting to feel it very difficult to breathe, losing control of your bodily functions before she was ventilated, and then waking up from it, thinking you're well, and then suddenly having a second hit of the brain inflammation.
He's successfully treated a handful of COVID-linked cases like this, but is concerned about the future implications, especially among children.
The amount of inflammation is phenomenal, roughly. How that would not impact the brain, we would struggle to think of. We worry that the long-term effect would be in essentially brain growth.
Since the start of the pandemic, the damage from COVID-19 to the heart and lungs is well documented, but several recent studies have examined its potential threat to the brain too. Dr. Mike Zandi at Britain's National Hospital for Neurology and Neurosurgery has helped lead this research effort in adults.
We certainly have seen some patterns in the brain scans with inflammation that appears new, and where we do feel that there is convincing scientific evidence that the patients had coronavirus first, and then they had this pattern of inflammation, and there was no other reasonable explanation.
As global coronavirus infection numbers continue rising, several neurologists in the UK and US told us there could be a second wave of neurological side effects in children and adults.
I think it's only going to be a matter of time before we see more and more of these cases. We've certainly seen some, and I fear that we are just at the beginning.
Nia still suffers from flashbacks and struggles with her memory. A 1-2 punch from coronavirus no one saw coming, that doctors fear could create a complex, painful legacy for yet more young patients. Willem Marx, NBC News, London.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.